Hello, everybody, and welcome back to the show. This episode is brought to you by The Wellness Paradigm, a holistic health coaching company shifting the way that women understand and heal their bodies. Through bioenergetic testing, functional lab testing, and functional nutrition, we uncover what traditional approaches often overlook, so you can stop guessing, start healing, and finally feel like yourself again. No more one size fits all protocols, just real answers, deep rooted healing, and the clarity and confidence you deserve to feel incredible. It's time to shift the paradigm of women's health. Now, on to our show. Good morning, Hanisha.
Hello, good morning, Shannon.
We have had a fabulous talk before we even hit record, but I'm excited to have her on the show again. And she is incredible. Hanisha is a naturopathic doctor, the owner of Maha Health, and she really helps with couples trying to conceive and get pregnant. So, welcome to the show.
Thank you so much for that lovely intro. I always like to say that I don't just help couples get pregnant, but I help them create generational health. Uh,
Mm.
that's a big part of what I do and why I feel so passionately about what I do. So I'm so grateful to be here to be talking to your audience about all of this.
Yes, and it's such a, it's such a much needed topic, especially the viewpoint that you look at things through, because as we know, fertility rates are very much been compromised, very down at this current moment. And, you know, a lot of people are not getting the help that they need in conventional ways. And even if they are, they're missing a huge component of health outside of just, traditional Western medicine. Not to say it's bad, right? It has its time and place. But I'd love to learn a little bit more. I really know, but, for you to tell us a little bit more about kind of what you do, and how you really got into this whole path.
Yeah, absolutely. So, um, we generally are supporting people from a very naturopathic lens. So, as you said, fertility rates are like now 1 in 5 couples struggle with fertility issues, which is a really high percentage of people dealing with this. And a big part of our program is that we work with both partners.
Yeah.
A lot of the burden of fertility, birth control, all of it has been put on women, and we're shifting the paradigm here. So I love your podcast on like shifting the paradigm because that is where we're really shifting the paradigm. Is that it takes two. It takes two, and that's why my program is literally called It Takes Two, because we work with both partners in optimizing their health and wellness so that they can be the most fertile selves, right? And it's through naturopathic medicine. For those of you who might not know, they might know from your show. You might have a few other guests, I'm assuming. But for those of you who don't know, essentially it is where we take the rigors of conventional modern medicine and combine it with the wisdom of nature and indigenous medicine. So we're using things like herbal medicine, nutrition, lifestyle, supplementation, energetic medicine, real, all of these things that can impact your health in mind, body, and spirit. We're addressing all of that. So we're really looking at you from a holistic perspective in mind, body, and spirit. And so within our program, like a big part of what we do is not just like, changing your diet and like really supporting you with your exercise routines and things like that, which are really important. And we also have a subconscious alignment and clearing and alignment coach who supports you in really shifting and removing any sort of mental energetic blocks and get those out of the way, because a lot of times that's a big part of it, right? Toxins are huge. We're exposed to so 25 times the number of toxins today than they were in just 1976, so just about 50 years ago, right? So that is huge. So the impact on our physical bodies is so real, that is very real, and I don't want to negate that. And there's a lot that we have been inundated with in terms of our mental, emotional, and spiritual health that has been completely neglected by everyone. And so this is a big thing in our practice to really address that. Like we just had a group call last night where we were talking about navigating the emotions on this fertility journey
Yeah.
and how to move through the emotions and not suppress them or bypass them, right? So usually most people are either like, I have no feelings, they don't exist.
Yeah. Coping.
Or yeah, what?
That's just their coping mechanism.
Yeah, exactly. They're just like, I don't have feelings. They don't exist. And then there's the other camp of people, which I like to like make the joke that it's like, the boomers were like, we have no feelings. They don't exist. You keep trudging along, right? And then now millennials and Gen Z, and millennials can kind of go into either camp sometimes, depending, I would say more often women go into the same camp of now, like now we're like all the feelings all the time. We're stuck in the feelings. This is our reality. Depression is our existence. Anxiety is our truth. And ADHD is our personality, right? Like these are the things that we have come to, and that's also not supportive. So how can we actually move through the feelings, right? Move through them, process them, feel them, and then move past them and through them, and not just stay stuck in them or suppress them. Yeah,
Mm,
so that's a big part of what we do. We're addressing all of you.
mm. Really, I'm so glad that you mentioned this too, because like, I mean, you have to feel to heal, and that's just a really often overlooked aspect of this whole fertility journey. And fertility, I mean, is a huge marker of just your overall health, right? You know what I mean? And it's like people do not realize all of this suppressed emotions. And this could also be generational too. I'm sure, it's a little more quotation woo, but it's like, this generational stuff that we carry through us too. Is sometimes holding us back and we don't think, oh, it's a food. It's, yeah, food's important. We talked about this before we recorded. It's like, the food, the toxins, all of that, exercise is important, but it's like if we also don't address the emotions, we're missing a huge key component, especially when you do get pregnant and you deal with the pregnancy and the postpartum, like that's gonna rear its ugly head if you don't look at it now too.
Absolutely. There's so much, and that's what I always like tell a lot of my women is like the greatest gift that you could give yourself prior to motherhood is learning to let go of control.
Yeah.
Learning to let go of that control and let go and just surrender to what is and accept it and shift that because yeah, when you become a mom, ooh, there's a lot of practice of letting go of control. There's a lot, right? And so the sooner we do that, the easier the whole journey will feel and it'll be easier for you to really be present with your kids as well, right? Because it's like this is what I mean by like creating generational health. I don't want to just help you get pregnant,
Yeah.
right? I mean, maybe IVF or something can help you do that and they just like force you to get pregnant. And we haven't addressed the root of your issues, your symptoms, your diseases, your traumas, any of that. And now we're just passing that on to your child. I'm here to help you create generational health. That is what I'm here to do. And that is the thing that I'm really passionate about. And this is something that I tell like, if you were on this fertility journey, if you've already been on it for some time, there's a purpose behind it. And starting to feel that, like I tell all of my clients, there's a deeper reason behind why you're experiencing this. And you were meant for a greater purpose. Like you weren't meant to just get pregnant and have a child. You were meant to literally heal the next generation and become the cycle breaker. And I know that's not always easy. It's a really hard, but like hard experience. And what's the alternative? Right?
Yeah.
What's the alternative? You continue to have the same issues, and then your kids have them, and then their kids have them. What is the alternative? Right? So we get to choose our heart. And I think being able to choose this heart of being the cycle breaker is such a powerful one because then you get to choose. You get to have that power and reclaim it and be like, oh, I'm shifting the paradigm. I'm shifting how my kids, my grandkids, my great grandkids feel because of the work that I'm doing now. And they'll look back and thank me. Right?
Yeah.
They'll look back and thank me, and I'll look back and thank me. Right?
Yeah.
I'll be like, wow, I did that. I'm proud of myself. Thank you. Thank you for doing that past self, right? I do that all the time whenever I'm like there are some things that come up with my parents, that were never that were always a trigger for me. And then now being with my son and like saying, I'm like, oh, like I did that. I'm proud of myself for doing that work, you know? And so I think that's powerful.
It really, really is. I really like that reframe because I think this is really, it's a very sensitive subject. It's a really
Yeah.
hard subject,
Yeah.
you know. And so what sort of tools are you kind of helping with clients from, a physical perspective and also just emotional perspective?
Yeah, absolutely. So from a physical perspective, we do definitely support, like I said, with the toxins, like that's a big thing. We do often do a lot of toxin testing because, like I said, we're exposed to 25 times the number of toxins today. And we found that the average umbilical cord has about 200 chemicals when a woman gives birth.
Wow.
And so, again, to me, it's not just about getting pregnant, it's about a healthy baby, creating generational health, right? And so, if there's 200 chemicals in the umbilical cord, where is that going?
Yeah. They're
Lead to the
starting off
baby.
life with all that, you know?
Yeah, like the baby's starting off with all those chemicals, and these are known carcinogens, right? Increases your risk of cancer. These are known neurotoxins, increases your risk of neurodegenerative disease or neurodevelopmental diseases,
Wow.
right? And we see a rise in all of these things, and it's really hard to talk about this because it is such a sensitive topic. And it's not to put blame it or anything on anyone who's already been through this journey, and maybe your child does have something like autism. It's about understanding like what might be the root of the issue and then shifting that where and when you can, giving yourself compassion and love and grace throughout this entire journey, no matter where you are. And I think that's really important. And so it's like, um, it's literally that saying, like, once you know better, do better, right? How's that go? Can't remember it.
Right.
Oh yeah, do the best you can with the information that you have, and then once you know better, you do better, right?
Yeah. Yeah.
That's really what it is, right? And then you do the best you can again, and then once you know better, you do better, right? Like that's just that's the journey of life,
Mhm.
and so giving yourself grace, compassion, forgiveness, love through any other aspect of your life. Like you didn't. I have some women who are like, oh, I like used to smoke cigarettes or I used to do this and they're like blaming themselves so much for being in this journey and it's like no no no
Yeah.
that's not helpful, right? So so just talking about navigating those emotions, like is that helping, right? Is it helping to like berate yourself and get mad at yourself all day? Is that actually helping, blaming yourself for everything? No, probably not. I'm not even gonna say probably, like it's not.
Yeah.
It's actually not. It's not helping at all. And so giving that version of yourself love and compassion, right? Like it's okay. And then now what are we doing different? And now what, right? And that's the question that I always like to ask is this happened and now what? Right? This is what the labs are showing, and now what? And so that's where like a big part of it is the toxins, right? Removing those toxins out, and then also addressing any lab issues. We do a lot of functional lab testing and really understanding the why. Like we have a couple who we're working with right now, and they're I really appreciate them. And so this is for anyone who, if you're even just considering having kids, now is the time, right? Like even if you haven't like tried yet, you're just like, oh, maybe in the year and next year or so, now is the time to really start working on your hormones and fertility and overall health. Because again, it's not just about getting pregnant, it's about creating generational health. These women who have 200 chemicals in their umbilical cord, they were clearly able to get pregnant and have a baby, right? But what does the health of the baby look like? That's what we want to focus on, right? And so I have this couple who's really proactive. They're like, okay, we want to maybe conceive within maybe in a year or so.
Mhm.
And so we decided, so I was like, great, I love that. Let's start working together. So we did all of the lab testing for both partners and found for him, which he thought he had pretty much no symptoms, which a lot of guys I think feel. Um,
Yeah.
even if they do, they're and that's again a part of the suppressing the feelings, right? Suppressing any sort of feeling, whether it's pain or discomfort, you just suppress it and be like, oh, it doesn't exist. And he was actually falling asleep after every meal, and I was like, that's not normal. And I was like, that's very much not normal. Like he's like, oh, just everyone does that. I'm like, no, they don't. No, no, we don't. A lot of us have energy after we eat. And so I was like, that's not how it works. But we did the testing for him. We found that he had insulin resistance and he had hypothyroidism, right? These are things that would have gone completely unaddressed had we not have tested that. And then being able to understand how that also impacts his sperm, right?
Yeah.
And just side note, we're looking at labs a lot differently because the average sperm analysis today would have been considered infertile just 20, 25 years ago, right? So we're looking at things differently. And what they've done with the ranges, it's actually so messed up because I talked about how the burden of fertility has come on women, right? And the truth is, men's health has just been completely neglected, right? Women's health has been neglected, and we've just been treated really poorly, quite frankly. And men are just like never even looked at. They're just like, oh, you're walking, breathing,
Yeah.
you're fine, right? Like, and that they're not even testing much at all. And so by neglecting their health, even in the fertility space, neglecting their role in the fertility journey, we're neglecting their health because their sperm health is associated with heart health, their brain health, their mental health, everything. And what they've done is just reduce the ranges or lower the ranges of the sperm analysis because the average sperm count, quality, motility has declined. And so what they did was just decrease the ranges when really they should have been like, oh, how do we support these men in improving their ranges, right? And that's the way we're looking at it. It's like, how do we support you in improving that range? Because again, it's not just about getting pregnant, getting
Yeah.
her pregnant. It's about you having a healthy life. And also, we also now know that sperm health can contribute to increased risk of miscarriage, increased
Yes.
complications during pregnancy, increased complications during labor or preterm labor, and postpartum issues for women, and the health of the baby, of course, right? So these are really important things that we need to address. And by just saying like we need one good sperm, which so many doctors say, drives me so crazy. They're like, oh, you're fine. His sperm's not great. We just need one good sperm. We'll do IVF. And now you're putting the woman through all of these invasive procedures, all of this, and it doesn't work because it's not just one good sperm. You need more than that. You need more than that. And now we've also neglected his complete health picture, right? And so this is why I'm so passionate about what I do is because like we want to address all of that. I think I answered in like so many ways.
No, I love that. I mean, it's important to take a comprehensive look, and comprehensive isn't just mind, body, spirit for the woman, it's for the man too. And there's more and more conversations about this, I feel like, in the last few years, which is good.
Yes.
Um, and I think that's what's so powerful too about your program too, is it really, I want to say forces because that's negative connotation, but it really allows people to have an insight on their health too, which I think again is the most important thing that you can possibly do, not only for getting pregnant, but being healthy for you, your kids, whatever.
Absolutely. Absolutely. That's and for your relationship too,
Oh
right?
yeah.
We've seen so many couples who are struggling in their relationship and like going through our program, things are improving because they're doing this together, right? Like this is a powerful journey that you get to do together. And there are also situations where we've seen like I mean, there's definitely been times where like, men have been dragged in by their wives. They're like, no, like,
Yeah.
we got to do this. And they're like, yeah, sure. And then they go through it and they're like, wow, I didn't know I could feel this good, you know?
Yeah.
I have a client, she's pregnant right now, and her husband also working with him she was just like, he was like, oh my God, thank you so much for making me work with Dr. Hanisha. Like, I feel so good. I had no idea I could feel this good. And like,
Yeah.
she was like, well, Dr. Hanisha is the one who's helping you. Why don't you go say thank you to her? And he was like, yeah, I mean, I will, but like, you made me do this. I was like, I love that for you guys. I'm glad that it really worked out. And of course, ideally, the more you're both involved from the
Uh,
beginning, it's gonna be a better experience. And we've had situations completely transparently. We've had situations where we've learned that, we have some men who have ED or erectile dysfunction, and that is going to impact sperm health and overall the relationship, right? That's
yeah.
going to impact the relationship. And things like Viagra don't even work for them, right?
Mm.
Cialis, Viagra don't work for them. And because we're getting to the root of it, right? Like you just said, we need to address men in their mind, body, and spirit too, right? Because they have that too. It's
Mhm.
not just women with mind, body, and spirit, men have it too. And by addressing that, we've started to uncover really deep-rooted traumas that some of these men have from like sexual abuse to a lot of times or any abuse as a child and then that leading to their use of porn, This is a
Yeah.
big thing that we've seen with a few of our men is like they're either using porn or they're using social media as a different form of porn.
Mhm.
Um, and then now they're feeling disconnected from their wives. And there's like, so, if you go to an IVF clinic, right? They're not addressing any of this, right? Now we're unpacking things that, yeah, it'll take longer than 6 months to fully unpack. I'm gonna keep it real with you.
Yeah.
It'll take longer than that to really unpack. But the fact that we're able to get to this, like we're understanding the root of the issue, right? We're getting to the root, and now we can support him in his healing of his mind, body, and spirit that has been completely crushed. And so I think that's, yeah, I just being able to do this work, and being in the space, the side effects that I feel like I didn't even realize, like creating this program, was that relationships are genuinely improving and feeling better, and we are really addressing men on a deeper level than most people even like think to consider, because their mental health is just as important as our mental health, and they don't have the same level of support as we do, I think.
Yeah, that is so true. Can't tell you how many people, men and women, but it's like people don't realize how good they can feel. Because I mean, until you fully heal, you're like, wait a minute, I was living like that? That felt so normal to me. Um, so that's always a beautiful thing when you're like, yup, I told you.
Absolutely. And that was my own journey too. I know I didn't really talk about how I got here, but like that was my own journey. Like I had a lot of autoimmune issues. I was always told that I would need to get on hormones to be able to have a baby,
Yeah.
like all the things. And I was able to reverse all of that. And I was like, whoa, we can feel this good. Like,
Yep.
what? I thought joint pain in your wrist. I just thought that was a little, like everyone has that, right? No, they don't. No, they don't. I don't have it anymore. And so I know that it doesn't have to be our reality. Like the digestive issues, I was like, oh yeah, it's like my normal to be constipated and not poop for 6 days.
Like it hurts my heart just
I
knowing that.
know. I know. I think about that old self and I'm like, oh, I have so much love for her. Like she went through so much and she had no idea it wasn't her fault, right? Like it's like she just didn't know. And that's okay, and now to be able to know and experience great health, which is why I created my practice, Mahan Health. Mahan literally translates to great or the absolute best. And I was like, wow, we can all experience this. And this allows us to really have bigger dreams. We know that we can really live the life that we desire. And that to me is like the big purpose of this, like having the dream of having a child and going beyond that. We've had some people who are like, I mean, even just our like one of our clients, she was like in a place where she just like was grinding and working on an hourly rate, and now she has just the ability to dream bigger. She's like, oh, I think I want to have my own business one day. I think I want. I'm like, great, but she wasn't able to even think of that possibility until she was able to feel better in her mind, body, and spirit. Because you can't even like, how are you supposed to do that? I think there's like this quote, healthy people have a million dreams and unhealthy people only have one, right? And I think that's really real. Like without our health, we have nothing. We have absolutely nothing. And so to create this for yourself before you even have children, so that now you can create this for them, is so powerful, because it's not just about having a baby. It's not just about getting pregnant. It goes so much deeper than that. I feel even more passionately about this now, because I have a friend who I just recently lost, and he was only 33 years old, and him and his wife are both good friends of mine. And they left behind, or he left behind. His daughter is now 3, and his son is now 1, and he never got to meet his son. She was 8 months pregnant when he had an aneurysm and went into the hospital. So he never really got to meet his son. He was in a coma technically when she gave birth, and so kind of, but not really. And so he left them behind, you know. And so I think this is something that since that happened, I'm like, it's like I feel even more passionate. Like we have nothing without our health. And the greatest gift that we can give to our children, our future children, is our own health. That's the greatest gift we can give them.
Mm, so true. I feel like that's it's a good wrapping up point because I feel like that's just such a powerful message. You know, we get really
Mhm.
trapped in this being about us, and it is,
Mhm.
but the ripple effects are so much greater too.
Mhm.
So,
Yeah, I mean, and like you said, it is also about us. So the greatest gift that you can give to your children, your future children, and yourself is your health, right?
true.
We have nothing else. I mean, this is something I mean, as a mom, I grew up in a very conservative Indian household, where the moms sacrificed everything, right? That was the idea. And I think a lot of us grew up with that kind of mom. And I knew I was going to do things differently. And I genuinely still feel like I remember there was an auntie who told me, she was like, "Oh, you understand now that you have a child, like they always come first." And I was like, "No, I need to take care of me so that I can be here for him." And
100%.
I very much feel that, right? And my cousin right now, she's actually struggling with some health issues, and now she isn't able to be present with her kids.
Yep.
So I'm like, this is the proactiveness, like because she was like always taking care, like everything was for her kids. She neglected her own care, and
Yep.
now she's not able to be there for her kids, right? And so this is why this is so important to be proactive with it and take care of yourself first, because then you can really show up as your best self. Right?
100%. 100%. That's how I got into a lot of my functional health journey was wanting to just get rid of this autoimmune stuff to be present for my kid. And when I got pregnant someday, I was like, I'm not dealing with this.
Yeah,
He or she is going to need all my focus and minerals.
exactly.
So,
And the minerals, yes.
minerals.
And to be able to give them that gift, right? Like honestly, since day one, I was not breastfed. My son was breastfed, and he has had beautiful bowel movements since he was born, and I had digestive issues since I was born,
Yeah.
and so like to be just to like see that and have gratitude every time he poops, like I'm like, yeah, like we we did it, like I didn't pass
So
this on,
much.
like I was able to not pass that on to him,
Yeah.
and there's still things that I have, like I'm still working on, right? Like that it's
Always.
never ending, and that's okay. But it's definitely now more of like the mental emotional health stuff that I'm like, oh, okay, yeah, we're still working on it, right?
Always a work in
Because
progress.
that one never ends. The spiritual journey doesn't really end, right?
No.
Unless you've reached enlightenment, which is cool, awesome. Great for you. I'm not there yet.
Got a
But
while.
yeah, it's like it's powerful to be able to see that in your kids then, and you just like feel like, oh my gosh, this is amazing. You know, my son just he got really upset the other day because he wanted to watch another episode of a TV show. He ran off and was just
Oh,
like, to be able to know how to regulate at 3 years old. What?
yeah, wow.
Like, what a beautiful gift, you know? So this is why this is important. This is why I love what I do. This is why I'm so passionate.
That's amazing. I love it. And I love those
Yeah,
stories.
I know.
Anisha, if people wanted to connect with you, find you, learn more about what you do, please let us know where they can.
Yes, of course. So I'm on all of the social media platforms. However, I am most active on Instagram, and all of my handle for all of them is the same. It's Holistic Hanisha. And so you can find me there. I also have our practice Mahan Health. So you can find me on the website if you're ready to book a discovery call. That's where you can find us, and we can support you on this journey. And the other option is like we do have like a fertility quiz for both men and women. We have two quizzes right now, and it's about finding your like fertility spirit animal type. And so it'll help you understand how fertile you really are. And so again, even if you're not already trying, it's a good thing to kind of just like see like, hey, where are you? And are there things that we already need to work on so that we can optimize your health and fertility when you are ready to have a child?
Yes, do it earlier than you think you need it. It's like literally.
Yes.
Yes. Well, thank you so much for taking the morning and chatting with us. Beautiful conversation. And I definitely highly encourage if you are in this position to go check Hanisha out. And if you guys found this insightful, I'm sure she would love a DM or me or a
Yes.
review. If you want to review, this is always very helpful too to reach more women and men who need to hear this conversation. Um, but otherwise, thank you so much for being here. And thank you, listeners, for being here. We'll catch you guys on the next show.
Thank you.
Thank you.